Mm, so, are you seeing the PPT now?
Yeah.
Yes.
So, these are the drugs I kept for today: Meserium, Ocimum, Psorinum, Pyrogen, and radium bromide. Radium bromide we'll see because though I was planning only this much, in between later I added Ocimum canum also. As per your syllabus, you have to study only Ocimum sanctum, which is an Indian remedy. Even Ocimum canum is also Indian, but still I put that also because both of its sphere of action, the clinical indications are very different. So I don't know, radium bromide, maybe I don't take it for today also. Let's see how it is going. So starting with meserium. So what do you know about meserium?
Skin.
Hmm. What is the specialty of meserium skin?
Rusty.
Crusty, yes. And underneath?
Using
Yeah, there will be some thick, very purulent, offensive discharge. If we remove that crust, usually it is seen the meserium is indicated in scalp dermatitis or scalp eruptions, in which the external appearance will be so crusty, and if you are going to, it will be so sticky, sticking into that body part, and if you are going to remove it, underneath we will see that thick whitey white colored discharge, and it will be very offensive, and it will be breeding vermin also. So that is the characteristic skin condition of meserium. So sometimes we see people who are desolated in street. They might be having some ulcers on their body without taking bath regularly, not keeping hygiene. So some small eruptions might have come on their body, small cuts or wounds, which later it goes into a unhealing stage, and then we often see smell coming up because the vermin will be breeding in them. So, in those skin conditions where we see the vermin even breeding, because we have the medicines for skin like sulfur, Psorinum, even today what you're going to study, this radium bromide, then graphitis, calcarea, hepasulf, silicea, and so many remedies are there for skin complaints. But when we specifically learn about a medicine which can be indicated in skin condition where even the vermin will breed or the worms will breed, that is the specific feature of meserium. So meserium, common name is Daphne meserium, also called as Meserion, paradise plant, February Daphne, belonging to the family Thymelaceae, because it's having a different name for their family. Common name, definitely it won't be Yux. Yeah, Meserion, no, paradise plant is so different from its actual name. But still, the common name that we say about Meserium is Daphne Meserium. So from Daphne, because the word Meserium is there, you will definitely understand Meserium is a common name. So from here, the possibility is to ask the family name because it is so different than Malaysia. The non-effects, I'm saying you all the MCQs, and see, I see some of you. I don't know from where I will bring very, very difficult MCQs for you. I would like to go and find out. But some of you even score full mark in MCQ. But some of you are not able to score that high also. But I should stop you giving the clues what MCQ I may put. But I can't control. I will anyway say. Whatever. But what I said was because when I was correcting your midterm paper, I felt like I shouldn't give you clues what question I may put. So some of you are scoring full marks, even in MCQ. I don't know from where I will be putting more MCQs. I make it more complicated that some of you are not able to answer also. Hmm. So non-effects, this medicine or this plant is actually highly toxic. Even when the skin is getting into contact with the sap, it can cause dermatitis in some people, like that of Rustox, anacardium, etc. Habitat usually seen in damp area, mixed woodlands, and soil that is rich with calcarea. Range Europe, including Britain, Scandinavia, doesn't matter much. Homeopathic preparation, tincture of fresh bark that is gathered just before the plant flowers in February and March. So this will be the general the appearance of the scalp with that particular dermatitis, the fungal infection tinea, or what is called as curio. The mesarium, the thick, crusty, discharging eruptions, that itself is the key words for that. In the mind, there is anxiety. The person will be having fear, and that is arising from the stomach. Empty feeling as if something bad is going to happen. Such a feeling we can even see in case of Psorinum. Anxiety when alone, their mind is somewhat similar to that of Psorinum. Anxiety when they are alone. Confusion of mind from interruption, knows not where he is, cannot distinguish objects around him. Vanishing thoughts while speaking. This feature is not of that much important in Mesarium. Maybe we can connect it like I say you a desolate person who we see in some street who has not taken proper food for many days. He that person they may be having some confusion of mind. They can't even properly communicate or where he is, cannot distinguish objects around him, etc. Apathy, indifference, everything seems dead to him. In the physical sphere, it is the eruption, the thick, crusty eruptions with discharging pus beneath, especially on the scalp region. That's the feature. Ailments from suppressed eruptions, eczema on back of hand with itchy vesicles. Chilly, the person will be extremely chilly and aggravated by cold. Affected parts become cold. There is internal bleed burning with external violent burning itching in spots, skin burning from perspiration. So though there are chilly patients and cold aggravation, they will be having that burning sensation similar to sulfur in even Psorinum. All that because of that skin condition, they will be having that itching and also burning after to that itching. Uh, Sudden pain followed by chilliness, numbness, and soreness. There will be discharge from urethra, burning in urethra at close of urination with mucus. So this indicates a condition of urethritis. But clinically, because we have so many other remedies for urethritis, this is not given much importance. The skin itself, mesarium, is the characteristic one. They desire for fat, ham and bacon, and aversion to milk, aggravation evening, touch cold bathing, amelioration eating while eating or and also in open air. It is more indicated in case of light-haired people, irresolute persons of a phlegmatic temperament, very torpid in nature. They are very hypochondriacal and despondent. Despondent because they feel like everything in a doom condition or in a negative will be totally pessimistic, indifferent to everything and also to everyone. They get angry at trifle or even the uh, least small matters and perfectly harmless things, but is soon sorry for it. They get so angry very easily, even for very light matters, but then after to that, they soon feel very sorry for it. The principal use of this remedy, according to Kent, is in eruptions and ulcerations. The most violent and important of its symptoms are those of mucous membrane, skin, and periosteum. Periosteum will be the layer that is closer to that of the bones. So, for the conditions of acute osteomyelitis, or even the recurring, the chronic, because the periosteum is also a location, we can think about this medicine in case of osteomyelitis. And in osteomyelitis also, you know that there will be, because of the action, there will be a fulcrum or a hole that may be formed, via which, like a vent, via which the pus will be discharging outside, and it will be very offensive. So in that manner, this medicine can be indicated for this osteomyelitis condition also. The outer surface of the body are in constant state of irritation. There will be nervous feeling, biting, tingling, itching, changing place from scratching. Almost what we say for sulfur and Psorinum, that indicates the deeper skin affection in case of the skin eruptions of mesothelium. Even when there is nothing to be seen, there is violent itching, and the patient rubs and scratches until the part becomes raw, and then they have that burning feeling. Itching changes place. The part becomes cold after scratching, cold in spots. Itching changing place after scratching, especially when associated with no visible cause. As soon as he gets warm in bed or as soon as he goes into a warm room, the itching begins, similar to that of sulfur. There is formication. The patient is so nervous that he is compelled to move and to change positions. Vesicular eruptions over the skin, running a certain course, itching, burning like fire. This is also important that they feel like the burning of fire. Though somewhere over here they are saying that after the scratch there is a sensation of coldness or cold in spots. More than that, that burning, that is burning like a fire. That is very much characteristic in case of mesothelioma. It dries into a crust and disappears. A new crop appears near or in the same place. Vesicles form crust beneath or under to which there is ulceration, and this crust turn white chalk like, thick, tough, and leathery. They are often elevated, and under to that crust there will be thick white pus, sometimes yellow white, which will be oozing out with violent itching. The pains are aggravated by cold, but the itching and restlessness are worse from heat. A child tears at the eruption with his fingers when the crusts are present. The head, the scalp region, there will be thick white elevated crust under which we have the putrid or very offensive yellow white pus and vermin that is found. Acrid pus eating away the hair. The eruption spread to any part of the scalp, especially to the top. It is also found beneath the ears and above the face and chin. So, put in short, how much ever PPTs we say, the slides we say in mesothelium, the ultimate key points that you have to remember will be that thick, crusty eruptions that is seen, especially on the scalp, and under to which there will be collection of very offensive putrid white or yellow white pus, and there will be vermin growth which will be terribly itching, and there will be a burning pain which or it burns like a fire. That's a characteristic feature of mesothelium. So that is about mesothelium. The second remedy for today is Ocimum sanctum. Its common name, it's an Indian remedy. Common name is Vishnu Priya. Oh, I put only Vishnu Priya. Sorry, it is Vishnu Priya. Tulasi or holy basil was proved by Dr. Murray and natural order Labiaceae. Even the next remedy, Ocimum canum, it is also proved by Dr. Murray and natural order is Labiaceae. And tulsi, maybe you know there are different varieties of tulsi. So this is one variety of tulsi. In India, we actually consider this as a holy plant. every form of tulsi, okay, every form. But in particular one form, that is this one, we grow it actually in our courtyard. Every Hindu house will be having this grown in their courtyard outside. So clinically, this is given for asthma, upper respiratory tract infections like for cold, catarrh, cough, fever. Dr. Murray reports it as a specific for warm affections. Though, one second. Though it has been told as a specific for warm affections, I don't know whether Tulsi is being given for warm affections. But when I was a child, when we were more accustomed or practiced of having a natural way of living, rather than if nowadays a fever comes, cold or headache, or initially that the fever is that cold coryza comes at that time itself. If we have something very urgent to do in work, in office or something, people we or even the people will be generally going for paracetamol. But in earlier days, in yesteryears, when I was young, my parents, they used to, when I have this fever, the first thing that they would be making to do will be making a decoction of this tulsi with what is that? All the spices that is available. The especially pepper, the corns actually, the peppercorn, and then there is something else, um, cinnamon. Yeah, the cinnamon bark they put, and then my mom make a decoction. So horrible to drink. It will be so bitter. The fever is already there, and then to drink this is another biggest punishment to have in the life. But I would be made, not just me, everyone in the family would be made to drink this. And even then, so if it is just a mild fever, it is going to get relieved very soon. Like in one day, it will go off. You drink that liquid very hot, and then just cover the body with a blanket. And definitely, you are going to go into a sweat stage. And after the sweat, the fever is going to relieve. So by evening itself, if it is a mild fever, we are going to get amelioration. And even if in one day if it didn't work, then only we were usually used to take to the doctor or hospital, and then the treatment taken. So otherwise in almost all the fevers, this tulsi decoction was the main thing to be given. So maybe because of that, in all India in those time, now not now anyways, in those time, they used to have this tulsi decoction during fever, that initial stage. So that might be the reason why Dr. Murray he decided to prove this drug. Uh, because in India, because of the influence of Ayurveda, we have a lot of knowledge about the natural or the herb medicines. And as long as now, when I was taking a tulsi decoction during my childhood for a fever, it was never a homeopathic treatment. It was just a empirical. It was not even Ayurvedic also. The proper Ayurvedic, no, not according to their principle, it was made. I could say it was a empirical medicine that was tried on me. The hearsay, then the method of preparation, my mom following from her mother, and that was traditionally given, and that mode only I can say it was never homeopathic. So maybe that Dr. Murray was interested to prove these remedies, to know in homeopathy when we prove what are the symptoms we are going to get. That might be the reason that he proved this remedy. So these symptoms, the first three, asthma, URTI, fever, especially fever and URTI, that's what I told we were given. But this one, worm affections, I'm not sure homeopathically whether it is indicated. I mean, of course, when he's saying it is indicated, but I have not seen any child being given tulsi or tulsi tincture or this Ocimum sanctum tincture for worm affections. Then in mind, the person will be forgetful, lack of concentration, prostration, drowsiness, falls asleep while answering. So rather than forgetful, we can concentrate on the other symptom. There is a lack of concentration, prostration, and drowsiness. Like when the person is having an initial fever, uh, the person will be already very much tired, prostrated, and drowsy, and he falls asleep while answering. You remember any other remedy which is having the symptoms? Fall asleep while answering. You're questioning them something, they give you answer, and while they are giving the answer, they go to sleep.
Opium.
Another one, opium, they will be more in a besotted nature, not opium. Opium, but yeah, they can go in a narcotic condition. Yes, but
Is
there
it
is another medicine
Bacteria
also.
or Anika?
Yes, 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 Patricia. Uh, Anika, actually, they give answer. Whatever the question is being asked, they give the answer, then they go to sleep. But Baptisha, while they are answering itself, they will go to sleep. So Baptisha is more apt over here.
Another one I think will be hyacinthus also falling asleep when answering.
Yeah, Alzheimer's can. In head, whatever the symptoms we see in this drug, it is like you can prepare, even if you don't study. If you just imagine a patient or imagine yourself when you have a slight fever, what all symptoms you might be having, you can put all those symptoms over there. So in head, definitely the person in the start of a fever, the cold cough stage, definitely he will be having a headache. So here also we will see headache, throbbing in nature, as if nails were driven to it, like what we learn in case of ignatia and atremure tuja, as if a nail has been driven into it. Like that, the headache will be which is relieved by pressure. Vertigo will be worse, especially when the person is walking, and it is better by wrapping up the head, like what we see in Silesia. Heat on vertex, better by pouring cold water. In case of eyes, there will be slight lacrimation and also some reddish, painful condition, similar to those symptoms when a person is having fever. In from ears, there will be watery discharge from the ear, or sometimes it will be very offensive first from the ear, and because of that, there may be some shortness of hearing. But this shortness of hearing, it's never like that person is having a deafness, not a permanent deafness or something, but just because of his ear infection, that acute infection, and the pus or the water being collected in the ear, he will be having some shortness of hearing also. The face and mouth. Face might be pale or red. Lips are either bright red or it can be as if burnt, like that, dry and black. There can be watery salivation or putrid bitter taste in mouth. In fever also we find that if not putrid, a bitter taste in mouth. There can be acne that is present in mouth. Tongue is bright red, even the sides are red, but the middle portion of the tongue will be deeply coated. Pain in the throat with difficulty in deglutition. So now you can see that there are many symptoms given, but almost all these symptoms you can relate to a patient who is having fever. That's why I told you don't have to by heart. Just remember how the feature will be of a patient who is having fever, and then you can write the symptoms by your own. Then chest, there will be some chest pain because the person we told it is indicated in case of cough. So there will be chest pain while coughing or sneezing. It is indicated in asthma. So the person can't lie on bed quietly during asthma. It will be difficult, and there will be pain in the mid part of the sternum. In the stomach and abdomen, though in the first sentence in the introduction part we learned that Dr. Murray has called this as a specific for worm complaints, we don't see when we come to that specific organ, the stomach and abdomen, we don't see the word or anything related to worms over there. So I don't know this single sentence, how it came, or what was the concomitant things which made Dr. Murray say that, I don't know. So in stomach and abdomen, there is flatulency. A gurgling sound can be heard from the abdomen. There will be, like, it is a good indication for diarrhea actually. There will be irritations, a heaviness in abdomen, and that heaviness or that flatulency, gurgling sound in the abdomen or heavy sensation, nothing of it will be relieved even after stool. There will be a gripping pain in liver or spleen region. So the gripping type of pain in the right or the left upper quadrant of the abdomen, in liver or the spleen region. Stool, it can be of any nature. It will be copious, offensive, mucus or bloody, or sometimes yellowish or greenish. So any type of coloration or discoloration is possible. It will be copious and offensive. There will be involuntary stool during fever. Diarrhea may be present in rainy season or autumn, but the feature is the stool is not going to relieve any of the symptoms like that of the nux vomica. In case of urine, there will be involuntary urination in children, frequent desire to urinate, and burning while urinating. Now, when we go to the other medicine, Ocimum canum, we can see there are some symptoms related. I mean, not some symptoms. Ocimum canum is usually related to symptoms of urethritis, urethral inflammation, stone, etc. So, because they belong to the same family, maybe that's why even in urethral, some of the symptoms are seen in case of this Ocimum sanctum also. But still, this is theory wise. In clinical practice, what I have seen is Ocimum sanctum mostly given for fever and related complaints, and Ocimum canum is what which is given for urethral complaints. Though some mixing up of symptoms is seen. So we can see some symptoms of urethritis in Ocimum sanctum also. When you are writing the exam, it doesn't matter even if you miss when you are asked the indications of Ocimum sanctum in fever. Even if you miss urine, it doesn't matter much because most of the symptoms what we learn in urine, I would say it is more important in Ocimum canum. But associated with fever, sometimes the fever may be associated with a UTI. Then we might have some urinary features like there will be burning during urination, frequent desire to urine. So then, yeah, like that, if it is associated with fever, the acute acute UTI, acute urinary tract infection, then Ocimum sanctum. In female discharges, this is a good remedy for leukorrhea. There can be offensive lochia that is lasting for a long period. And lochia, you know, it is the discharge that is coming out from a lady who had delivered baby for some 90 days or something, the lochia. Initially, the color will be changing. Initially, it will be very offensive, brownish, and then it will become more plant. So if it is lasting for a longer period, I mean, very offensive, then Ocimum sanctum is a good remedy. There will be profuse bloody discharge after delivery. So coming to fever, all these symptoms, whatever we mentioned, along with that, some characteristic fever, the typical influenza fever. So it is an excellent remedy in influenza and fevers that is associated with cough. There will be acute pain in the body or bone pains. There may be soreness of muscles and terrible headache. Typhoid fever with chilliness. Typhoid fever, we can relate it with its gastric symptoms also. We have seen the diarrhea, the nature of the stool. and that not relieving the symptoms, we can think. So connecting like that. There is burning sensation all over the body. The person will be in a delirium, drowsy, or comatose condition. The potency, the choice of potency will be usually mother tincture or 3x. What I have seen is mostly being prescribed tincture. The next variety is Ocimum canum. So this is another variety. In India, we call this variety as actually Rama Tulasi. The other one, we just call it as Tulsi. This one is Rama Tulasi. And then there is another Tulsi, which is like more of mm, a dark colored leaf, a dark purple colored. I can't say black color. It will be purple but dark purple, which we call it as Krishna Tulasi. So anyway, this is Ramatulasi in its appearance. So even this we will be growing in India, or it will be growing as a shrub anywhere. But this is not given that holy basil status as like that of the Ocimum sanctum. As I told you, in every courtyard we'll be planting this, and in some of the Hindu houses, not all, those people who follow that particular culture of Hindu religion, they will be lighting this lamp in front of that tulsi, not this tulsi, that tulsi, the earlier one, the Ocimum sanctum one, every evening. So, Ocimum canum, this is not in your syllabus actually, but just because of the close similarity of the drugs, and also this is clinically useful. Ocimum canum, I thought I will discuss about this medicine also. That is Brazilian alpha vacca belonging to the family Labiaceae, and part used is tincture of fresh leaves. So, indication, it is to be remembered in diseases of the kidney, bladder, and urethra for uric acid diathesis. So, whenever there is a urinary electrolithiasis that is formed, and especially of uric acid variety, we can think about Ocimum canum. Red sand in the urine is its chief characteristic and frequently verified, like what we say in Lycopodium. We have over here also red sand, which actually indicates because the stones are present, it is not the red sand that is coming out. There is no sand, in our body to come out. That actually what we say, oh, the red deposit, what they say is when the stone is coming out, it will be because of the spikes and that particular shape of that stone. It will be even hurting the mucus layer of the organs through which it is passing. So when it is passing down that mucus layer, when it is getting scratched over, that bleeding comes out and it may be getting clotted, and also that is why it appear in reddish in color, and because of the presence of blood, and also this can be because the stone is getting sometimes crushed upon when it is passing through the constricted areas of the urethra. So at that time it may be getting a little uh, particle will be getting dislodged. So even that stone's particle that will appear over there. So that is what they call it as the red sand. That part, the bigger part of the stone, the nephrolith, that being getting deposited as like in a powder form, and then sometimes because of this strong the spikes striking on that soft part, the mucus layers, the bleeding coming out, getting deposited, that also leads to this appearance. So the red sand in the urine is the chief characteristic and frequently verified. There can be swelling of glands, especially the inguinal and the mammary gland swelling. Renal colic, especially right-sided. So right-sided, other remedies, do you remember the renal colic right-sided one?
Lycopodium.
Anything else?
That's vomitor.
Axonica can be both sides. It's not specific to right. It is another specific.
Hubovich.
Mm,
Sarsaparilla.
mostly. And then, no, remember left side. Can you see?
Berberis.
This will be that like process. Anything else? Even we can think about phosphorus and also the back. Anything else? Anyone remembering for right or left?
Lycosis.
Lactis. Yeah, lactis is yeah, because it is left-sided, we can say, but it is not a specific. It can be because it is a constitutional remedy. So if the symptom similarity is the lactis we can give for anything. Huh? Okay. Symptoms of renal calculus are pronounced. Is someone saying anything? Then in case of urine, it will be highly acidic because we saw that it is indicated in uric acid diathesis. So it will be highly acidic, or the acid, the stone that is formed, it will be uric acid. Formation of spike crystals of uric acid. Urine might be turbid, thick, purulent, or bloody in nature. Brick dust, red or yellow sediment may be seen with odor of musk. It's very offensive. And pain in ureters with crampy pain in kidneys. So mostly, as I told earlier, it is the Ocimum canum which is indicated in urethral symptoms, nephrolithiasis, etc. But because both the remedies, Ocimum sanctum and canum, belong to the same family, the Labiaceae, they will be having the same alkaloid. So some similarity is seen in the urethral sphere for the medicine Ocimum sanctum also. But mostly Ocimum sanctum, like Eupatorium, is indicated in case of a influenza fever in the initial stages. Or even the whole treatment could be done. I think maybe during my parents' time, they didn't even go to a allopathic doctor or took a paracetamol. When they had fever all the day, they might have taken only the decoction. When it came to us, they just wanted to stick with this treatment only for one day. And one day, if the fever was not relieved, then we were taken to doctor. Might be that that also happened. So that one medicine, Ocimum sanctum, is mostly for influenza-like symptoms, and this one for the renal stones related symptoms. Then in case of males, heat and swelling of left testicle, the symptoms are not that important, okay. In female, the vulva is swollen, there is prolapsed vagina, darting pain in labia, nipples painful to least contact, breast feel full and tense with itching. For comparison, they have told the medicine berberis, Carrera brava, Hedioma, Lycopus or Lycopodium, probably Lycopodium, Artica urens. And this the dose is 6 to 38 potency. So about Ocimum canum, when I was searching Ocimum sanctum, usually what I do is in internet we'll get just type the drug name and also the order that we want, and it will be coming up. Every book now it is available online, or this thing will be coming up. So I just need to copy paste. But when I search for Ocimum sanctum, both in Boric and J.H. Clark, they showed only Ocimum canum. They didn't show Ocimum sanctum. And then because I had the Boric, the textbook, I took it. And Ocimum sanctum, I knew that Ocimum sanctum is put in Indian remedies. There is a separate section in Boric after they have given until Z, then they go to the repertory part. And after to that, towards the back pages, you might have seen there is a section Indian remedies. So it is the over the Ocimum sanctum was given. So then what I did was I typed from the textbook the Ocimum sanctum. That's why as earlier you saw some spelling mistakes also because I was typing. So the drug that which you get when you just Google in internet, that will be Ocimum canum in both uh, Clark and also Boric. In Boric, you have to go to the Indian medicine section to see the Ocimum sanctum. So Ocimum canum in J.H. Clark, it is said that is one of the remedy we opt to Murray, who tells us that it is used in Brazil as a specific for diseases of the kidney, bladder, and urethra. There will be renal colic with violent vomiting every 15 minutes. One wrings one's hand and moans and cries all the time because of that pain, the urethric colic. Red urine with brick dust sediment after the attack. The urine may be saffron color or thick purulent with an intolerable smell of musk. So two cases have been given. In fact, Judge Clark has given 4 cases, out of which I felt more interested in 2 of the cases. So P.C. Majumdar, a famous Indian doctor, relates the case of a medical man, 45 years. Majumdar was sent for to the patient at 4 a.m. one morning and found the patient in great agony. Pain in upper part of right kidney, extending downwards and forwards to the pubic region. There is constant vomiting, bilious acid tossing about without any relief. So when we see these symptoms, there is nothing much to ask to the patient, and we immediately understand it is a condition of nephrolithiasis or urethric colic. So the symptoms are similar in whichever drugs we learn, only the side get differed. So he tried the medicine Calcarea cup 30 followed by Lycopodium sepia sarsaparilla, and again he gave berberis. Though we say this as a left-sided, he gave berberis also, but nothing gave relief to the patient. And finally, Ocimum canum 3x was given, which gave immediate relief. And after to that, no other remedy was required. Then in case of a man of 50 years, same Majumdar case itself is this. There is excruciating pain in left kidney. Not the point, it is left kidney. Still he gave with Ocimum canum. So for left kidney, he had already received opium under allopathic treatment, which offered no relief. Majumdar saw the patient on the 6th day of the attack. The suffering was extreme, vomiting of bile, constant nausea, bowels constipated. Ocimum canum 3x, 1 drop every 3 hours, speedily gave relief, and 2 days later, 2 small uric acid calculi were passed. There was no recurrence after to that condition. So these were the 2 conditions or 2 cases given by Ocimum canum. So Ocimum sanctum, once again, for the fever, influenza fever related symptoms, and Ocimum canum for the right-sided renal colic, nephrolithiasis, especially of uric acid type. The next medicine for today is Psorinum. Psorinum. What do you know about Psorinum? Someone say to me, what do you know about Psorinum?
Um, a case not recovered properly, then can give Psorinum.
Mhm.
Um, s- yeah, s-
Have you given Sorina?
no, no.
I have given. Anyone, Lenny, have you given? Anyone is having clinical experience with Sorina?
Yes, yes.
For what condition did you give?
For skin eruption.
Uh-huh.
Yeah.
Uh,
Very chilly person,
mhm,
like arsenicum, but her skin looks very dirty
mhm,
and cannot stop scratching because very itchy,
mhm,
and on the scalp also. And I look at it, the skin very slow to heal. This is the complaint. And then the eczema is on the scalp, behind the ear, and crusty all over. Looks like mycelium a little bit, but mycelium got passed underneath, but this one no. Yeah. So some offensive smell.
mhm.
I have given 30C, only one dose, and then aggravates for about 7 days, and with the swollen, which is very scary. Then after 7 days, subside.
Okay. Is the case is still ongoing, or has it been cured?
Yes, ongoing. Yeah.
Okay. 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 So whatever Lenny told is actually the symptomatology, like that of a sulfur. Like sulfur, it is the king of. Is someone saying me anything? Well, Lenny, maybe you can
Sulfur.
off your mic. Uh, no, I was hearing my own voice. My own voice. That's why. Just.
Okay, okay,
Uh,
okay.
if you don't have anything to say, then just close the mic because I can hear my own
Ah,
voice.
okay, okay.
Okay, but if anyone has to say something, just open. I mean, just on the audio and say okay. So yeah, when we say, the king of antipsychotic, antisyphilitic, and antipsoric, when we were saying about Mercurius, we discussed that. So in case of when it is antipsoric, in general, among the remedies, it will be the king will be sulfur, and if it is the king of antipsorics among the nosodes, it will be Psorinum. So we have similarity of symptoms in case of sulfur and also Psorinum. The only difference mainly being sulfur will be a hot patient, complaints generally aggravated from hot weather, the warmth of the bed, and in case of Psorinum, similar symptoms but in a chilly patient. So that is the main difference between sulfur and Psorinum. And because this is a nosode also, this will be acting in a deeper level when compared to sulfur. It's not that sulfur won't go that deep, nothing of that sort. Even sulfur is the king of, when we say king of some particular miasm, here being the acidic miasm, definitely it is acting very deeper. But when it comes, the general characteristic of nosol, one of the characteristic, it is very deep acting, even very capable of cutting down the chronic miasmatic effect. So Sornum is much more deeper, but the main difference will be mainly regarding the one is very chilly, which is Sorinum, and sulfur is very hot in nature. So Sorinum, the snow sword of soda. The zero purulent matter of scabies vesicle was used by Hahnemann. So the content used was the scabies and the discharge, the seropurulent, that is a mix of the serum and the purulent discharge. That was used by Hahnemann to prove this medicine. The product of Psora sicca or epidermoid efflorescence, powdery deposits of pityriasis, that was used by Gross. The salt from a product of Psora by Herring. They used the trituration. In case of Psorinum, the chilly patient, very dirty in nature, desperate with itching eruptions. That becomes the keywords. So if it is sulfur, it would have been hot patient, and for them also it is they are very dirty. They don't even like to take bath. Very high unhygienic people, even sulfur, and they are also desperate with itching eruptions. So similar, but only the thermal preference changes. In Mendel, the Psorinum people will be more of a depressed nature, whereas in sulfur we see a philosopher, we see a person who is theorizing, a lazy person. Sometimes we say that he is a intellect, but still he wouldn't be much interested in his looks, a rag type of philosopher. That is sulfur, and a happy-go-lucky person, that is in sulfur. But in case of Psorinum, the persons will be more in a depressed stage, more desperate, hopeless, fear of poverty, fear about future, insecure feeling. That is very much characteristic of Psorinum. They're anxious about their health, despair of recovery, because of all their skin affections. They feel like ever whether they will be coming out from their disease condition. A forsaken feeling is the religious despair, fears busy streets. And physical, there is lack of vital reaction, and this is a common symptom of all the nosodes. They don't have that vital or the vital reactions. Even that will be much decreased in their body. So that is why, as Vinod told, the symptom comes from that. What was the exact sentence, Vinod? You told me. Vinod, did I lose Vinod? Vinod, are you there?
Yeah.
Yeah, what was the sentence you told me? The
Earlier,
first sentence. Yeah, the first sentence, yeah, about
then
Psorinum.
acute cases, acute infection or something doesn't still having some symptoms like not fully cured, then
Yeah,
Psorinum.
yes. When it is not fully cured, when there is an underlying miasma, the pathology being there, and also it can be because of this, the person's vitality is so lowered that no reaction is coming out from the body. So that is a feature of not just Psorinum, not of Psorinum alone, but on all the nosodes will be having. That is why whenever we feel like our one of the medicine has to act, but we are not getting any result and we are very sure this is the medicine, then better to give nosode as an intercurrent. That's what we learn, because nosodes have this feature whenever our vitality has gone that depressed that the reaction even is not coming up. Nosodes are capable of bringing back that reaction, vital reaction. We learned this symptom in case of opium also, which is not a nosode, but opium also has got this ability to bring back that depressed vitality. So this lack of vital reaction is not a symptom of Psorinum per se, but it can be applied to any nosode. The person will be very chilly, wear hat or overcoat even in hot weather, like that of a Baraita cup child. Great sensitiveness to cold air or change of weather. There will be offensiveness. Skin is very dirty, as if never washed, greasy in nature, as the symptom Lenny told. There will be profuse and offensive perspiration. Acts on especially the skin folds. especially the flexor region, the wherever there is a skin folding coming up. The patient will be driven to despair with itch, aggravated at aggravation wool. Or I am not sure whether it is wool or it should be cold. I'm not sure, or whether it is the cloth they are mentioning. I'm not sure about it. Okay. Eruptions with offensive discharges feel unusually well before an attack of symptom. This is the characteristic feature. They usually feel very well before the attack of symptoms. Always hungry during headache and is much ameliorated by eating. The similar symptom we can see even in case of sulfur. And sulfur, not just in headache, they are generally having that empty organ sensation at around 11 a.m. and they have to eat something. So similar feature we have got in Psorinum also. Both the drugs will be having increased appetite, especially at night. And this is a good medicine given for respiratory complaints, asthma, and they have a particular position like that of Medorinum, what we say, the Mohammedan prayer, like lying on the abdomen or on the knees, and the tongue or the nose touching on the floor. That is amelioration for the Medorinum. Over here, it will be dyspnea, amelioration, lying down on the back with arms stretched, like the Jesus lying on the crucifix. That's the position they get amelioration for asthmatic. So that position is very characteristic. And the aggravation of dyspnea will be from sitting up. Case of modalities, aggravation from, because they are chilly patient, cold air, change of temperature, warm bed, suppression of discharges, perspiration, eruptions, etc. In natremure also we can see profuse and offensive perspiration, but in natremure it gives a relief, but that is aggravation in case of perspiration is aggravation in case of Psorinum and also mercurius. Amelioration, again they have given perspiration, amelioration from constipation, summer or warm wet weather. Desire for alcohol, and that is seen in most of the drug, and aversion to fatty things, so pork. In Boric, it has been given the therapeutic field of this remedy is found in the so-called psoric manifestation. It is a chilly remedy, wants the head to be kept warm always, wants warm clothing even in summers, like Silesia, Bharatiya cup, I told you. Extreme sensitiveness to cold. There is much debility or prostration, independent of any organic disease. So there is no need that the patient should be having some organic affection, so some serious organ diseases or failure, organ failure. There is no need. Only then the person will be having prostrate. Nothing like that. It may be just constitutional also because of that lurking miasma underneath him. There will be a constant debility, prostration, etc. Especially for the weakness after an acute disease. There is lack of reaction, that is, the phagocytes are defective when well chosen remedies fail to act. The scrofulous patients, scrofulous means all the lymphadenopathy or the lymph nodes will be affected, especially in the throat region. Secretions will be having a very filthy smell, offensive discharges, profuse sweating with cardiac weakness, and skin symptoms very prominent. It can be given for syphilis, even in the tertiary syphilis, where gamma is the characteristic feature. Gammas will be soft swelling during the late stage of syphilis, and it occurs in the connective tissue of liver, brain, testes, heart, etc. And also can be given for cardiovascular syphilis, where the heart symptoms are prominent, or syphilitic aortitis is the, where there is psychiatric manifestations, memory loss or personality changes during the symptoms of neurosyphilis. When brain or spinal cord is involved, we can give Psorinum. But the symptoms Boric have given like that. It's not that Boric is wrong, but there is a sequence actually we have to follow. Because if it is, I don't know whether did you have to learn chronic miasm chronic diseases of Hahnemann. In that, Hahnemann has mentioned when we have different cases, how to treat the patient. So, according to him, if it is syphilis, syphilis is the most easy curable miasm, very easily to be cured. And psoriatic miasm is obviously the most difficult because of its hydra-headed nature. That's what he uses. But if it is a triasthmatic condition or a chronic syphilis, not the acute one. Acute one, he says, with very antisyphilitic remedies is very efficient. But if it is a chronic natured one, then that syphilis that will be mixed with the psoriatic miasm also. So when we are going to treat such a patient, and here Boric is mentioning not the acute or the primary stage of syphilis, but the symptoms indicating the tertiary stage. So in case of, not leave the syphilis disease, come back to the miasm. If the person is having a syphilitic miasm, and if you are going to treat that person with the syphilitic remedy, there will be a particular stage when the indicated remedy seems to not acting or further acting. And at that time, we need to give that patient a psoric remedy uh, and then clear the case, make the symptoms more visible, then only we'll get the other underlying. So, like a different planes or different planes or different levels we have to treat. So, in case of syphilitic patients, where the other miasm is lurking behind, after giving that acute syphilitic remedy, we need to go towards the psoric remedies, the medicines which are indicating for the psoriatic miasm. So, like that, so when you read this sentence, you shouldn't think like, okay, Psorinum, psoriatic miasm, then how it is coming for the treatment of syphilitic. Not like that. That is actually following when Boric says only that most important sentences taken from the textbooks, mainly from, I think Boric has taken from Clark. Clark, I think. Its main book is from Clark. Um, so they will be taking only those important symptoms and compiling that. But the totality is coming from the feature. Pardon? You came in the morning? Yeah. Can you see my colleagues inside? Because I'm still having class. Sorry. You can just go inside. Yeah, so it is not that proper syphilitic. You don't never confuse, but like why a psoriatic remedy is given for syphilitic. It is because of that layers of treatment which Hahnemann says to follow in case if it is a mixed syphilitic miasm. So in that manner, when the syphilis has gone into a tertiary stage, uh, Boric says this medicine is good, especially when there is gamma formation. This is usually a tertiary stage of syphilis, and also the neurosyphilis, cardiovascular syphilis, etc. At that time also we can think about that. So in mind, the person will be very hopeless, despair of recovery because of his diseases itself. He will be always itching, and it will be as if his skin complaints are never going to get cured. So he will be despair of recovery. There will be much melancholy, religious in nature, suicidal tendency. Uh, and in head symptoms, he awakens at night with pain as if from blow on the head, chronic headache, hungry during attack, which we saw earlier, hammering pain, brain feels too large, worse during change of weather. And even on the head, there is humid eruption on the scalp, hair matted, as like Lenny told. But the only thing is, here when they say humid eruption and whatever we told that thick, crusty, everything is there. But what makes it different is, as I told earlier, in Meserium, the vermin will be present. That is the feature. When we see vermin, the offensiveness, the only remedy that we learn in Materia Medica will be Meserium with the vermin presence. but that is not seen in case of Psorinum. And also the hair will be tangled like a plica polonica because they won't be washing their hair regularly, or the hygiene is not maintained. So in some people whom you see on the street, especially who have been deserted, they won't even wash their hair, and then we can see a mass of hair entangled, and then they're having some seborrheic infection or some dermatitis over there, with offensive discharge coming out. In those conditions, Psorinum is a good remedy. And that's called as plica polonica. It's also a good remedy for chronic ophthalmia. The eyes will be agglutinated, blepharitis, ophthalmia which is constantly recurring, edges of lids red, secretion acrid. Now this ophthalmia we learn in case of thuja, then natrum sulf, argendum nitricum. But if it is coming more frequently or recurrently, Psorinum is one of the best remedy. In mouth, there will be ruggets, crack and fissures, especially at the corners, like that of petroleum, graphitis, condorango. Tongue, gums ulcerated, but it will be having very offensive smell also. Tough mucus of foul taste adhere to the soft palate. In nose, there will be dry coryza with stoppage of nose, chronic catarrh dropping from posterior nares. Ears, it will be oozing scabs around the ears, sore pain behind the ears, offensive discharge from eczema around the ears with intolerable chronic otorrhea, very fetid pus from ears. So only the organs are changing, the symptoms are constantly remaining the same, very offensive, thick, and pustule or pustular or pus-like discharge, which is very offensive. Face swelling of the upper lip, humid eruption on the face, and sickly pale appearance. The person will be, because of his, we told one of the symptoms that he will be having lack of reaction after two acute infections. So, following to an acute infection, when the person has become anemic, that sickly, waxy face, which indicates anemia, that's also their feature. So face sickly is actually indicating their anemic condition. So that this is a good remedy, a scrofulous remedy. So even the lymph nodes, all that tonsils, adenoids of the throat region will be affected. So tonsils greatly swollen, painful in swallowing with pain in ears, profuse offensive saliva, the tough mucus, which is very foul smelling, getting attached to the soft palate. The recurring quinsy. Quinsy is actually tonsillitis, and that will be recurring in nature, not the acute effect. Like most of the children, you might have seen if you have, I mean, in your clinic, this is very common complaint that you are going to see children who are having this chronic tonsillitis, like the slightest cold they take, just a bite of an ice cream or anything, even a cold water or some cold juice they take, the next day they are having tonsillitis. So usually earlier times, the allopathic people, they just used to advise tonsillectomy, but now they don't, because tonsils are very much important, because our T cells etc. is being getting matured over there. So now they don't advise that, and usually the symptoms of tonsillitis that regress after once the boy or the girl get into their teenage. So at that time they naturally regress, then the effect will be very less. But still, in many or most of the people, but in some people where they have this tendency of chronic tonsillitis, even when they get into their adult age, 20 plus, 30 plus, even then they take the cold things, they will be having this tonsillitis related symptoms. So that shows that miasma still lurking inside them. So for that recurring type of quinsy, we can give this one, Psorinum. Eradicates the tendency to quinsy. During that tonsillitis, there will be hawking up cheesy pea-like balls with disgusting smell and taste. That's an important symptom. Okay, during that throat complaint or the scrofulous complaints, the quinsy, they will be hawking up a cheesy pea-like balls. So you have to remember that all similar words that has been used, and that will be having a very offensive smell. In stomach, there will be eructation smelling like that of bad eggs, just showing that eructations will be very offensive. That offensiveness is one of their key features. The person is always hungry, must have something to eat in the middle of the night. There will be nausea, vomiting of pregnancy, pain in abdomen after eating. Mucus, there will be bloody, excessively fetid and dark fluid can be given in diarrhea actually, where the stool is very offensive and the person will be having gripping pain. Hard, difficult stool with blood from the rectum and burning piles. There is constipation in infants, especially pale, sickly, scrofulous children. Female leukorrhea, there is fetid, lumpy, severe backache and debility will be there. Mammy is swollen and painful. Pimples oozing and acrid fluid that burns and excoriates the glands. It doesn't matter, but this one, leukorrhea, that is which is very offensive, very itching in nature, associated with backache and debility. Please remember that. In asthma, what I told you, the dyspnea was by sitting up, and better is lying down and keeping the arms spread apart. Feeling of ulceration under sternum, pain in the chest, better lying down. There may be dry heart cough with great weakness of chest. Cough returns every winter from suppressed eruption. Hay fever returning irregularly every year. If it is returning irregularly. Extremities, there is eruption around fingernails, even the foot sweat. The suppression of foot sweat is a ailment from in case of Psorinum, like what we see in Silesia, Bulgaria, Baraita cub, fetid foot sweats. The weakness of joint as if they would not hold together. More than that, it is the eruption, and eruption will be same thing, whatever you learned earlier with offensive discharges that is being coming up, and fetid foot sweat. The skin, once again, the same thing, dirty, lustreless look, rough hair, plica polonica, intolerable itching, herpetic eruptions, especially on the scalp and bend of joints, worse from warmth of bed, enlarged glands, what we learned, the scrofulous conditions, the lymphadenopathy, adenoid affections, or its enlargement, quinsy. Sebaceous glands secrete excessively so that the skin will be very oily in nature. Indolent ulcers, slow to heal, eczema behind the ears, and crusty eruptions all over. Urticaria after every exertion, remember that sentence. Fever, and during fever, there will be, this is not given for an acute fever, but person who is having some very serious type of diseases, in which they will be having one of the symptoms as fever, like tuberculosis, malaria, filariasis. In between, they might be having a flare of fever, HIV. No, something very deep in their body, not just an acute fever like an influenza, then you give Psorinum. No, it's not like that. Some very chronic disease is happening in the body, and sometimes as a reaction, a fever is arising. At that time, we can think about this only at that time, okay? But because the original reason is something else, only at that time, not for an acute fever per se. So here there will be profuse offensive perspiration with night sweats. That's not the feature actually. The feature is some other diseases and then that affecting the constitution. So at that time, Psorinum, sleepless from intolerable itching, and the person is easily startled. Similar, these symptoms similar we can find in sulfur. Modality is aggravation from coffee. Psorinum patient does not improve while using coffee, and you need to remember this sentence because when you're uh, giving Psorinum to the patient or someone, if they are taking coffee, they should be definitely prohibited from taking coffee. Um Changes of weather in hot sunshine from cold, that is aggravating factors, and dread of the least cold air or draft. Amelioration from heat, warm clothing, especially or even in summer. In Netherlands, the constitution they say is adapted to the psoric constitution, extremely psoric patient, nervous, restless, easily startled. Children are pale, delicate, sickly. I'm not saying this because I already told you how this person will be like, they will be very anemic in nature. Sick babies, and this is important for the MCQ, okay? Sick babies will not sleep day or night, but worry, fret, and cry. Child is good, play all day, restless, troublesome, screaming all night. So, Sodinum and Jalapa are the remedies where the child is very happy playing in the morning time, but at the night time, the child will be very restless and screaming all night. They are having anxiety, evil forebodings, very depressed, sad, suicidal thought, despair of salvation, of recovery, fear that he will die, he will fail in business during climatic period, making his own life and that of those about him intolerable. Ailments from suppressed itch or other skin disease when sulfur failed to relieve, severe from even slightest emotion. In chronic cases, when selected remedies fail to relieve or permanently improve. When sulfur seems indicated but fails to act. Lack of reaction after severe acute diseases. Appetite will not return. Um, Weakness and debility from loss of vital fluids, especially after acute disease. Independent of or without any organic lesion or apparent cause. Body has a filthy smell. The whole body is painful, easily sprained and injured. Yeah, this is a symptom that has to be remembered. Easily sprained and injured, whole body painful, that which we learn about arnica, bacteria, pyrogen, uh, Restox. That symptom will be the whole body being painful. Like nowadays, there is a condition like fibromyalgia, um, which is now very commonly told. The whole body will be pain, will be the patient will be complaining about the whole body being painful. And when we take the X-ray, MRI, or whatever, everything is negative. It might be if the person is old, like 60 plus, there may be some bones may be showing osteoporotic changes. But when we ask the symptom to the patient, patient will be saying pain not related to the bones, but generally the muscle part. They will be showing that part of the body where it is completely muscles in the back region, not the spinal region, but in the lower lumbar region, the gluteal region. They will be having pain over there where there is no bones. I mean, bones are there, but thick muscle layers. So fibromyalgia, that condition, the whole body is being painful, easily sprained, injured, sensitiveness to cold air. And like phosphorus, this we told already actually, he feels acutely restless for days before or during a thunderstorm. The eruptions which disappear in summer and return in winter, similar to that of the sulfur. Feel unusually well day before attack, hungry in the middle of the night, and they have to eat something like sulfur and cinna. Profuse perspiration after acute disease with relief of all sufferings. Sleepless from intolerable itching or frightful dreams of robbers, danger, etc. And all the excretions are very offensive or carry on like odor. Canum is closely allied to sulfur. The patient dreads to be washed. The skin, especially face, look filthy, though it has been well washed. A dingy, dirty, foul look, as if covered with dirt. Skin is rough and uneven, cracks easily, bleeding fissures. He cannot keep it clean. The skin of the hand is rough, chap easily, become thick and scaly, easily cracks, breaks out in little scaly eruptions. Look unwashed, he always appeared to have dirty hands. Somewhere it is similar to graphitis and petroleum. Many of the complaints of the skin are worse from bathing and from the warmth of the bed. The skin itches when warm, itches when wearing wool. Oh, maybe this is where that sentence came from, aggravation from wool. So it is the woolen clothes that is going to cause more itching. Itching when warm in bed, he scratches until the part becomes raw, like that of sulfur, and then it becomes scabby. When healing takes place, there is itching, and then he has to scratch. Violent itching, even without any eruption. What's the similar symptoms? Can be given for when the eruption has gone for some time. The crusty formation and vesicles mingle. The skin become thickened and indurated. Then new crops of vesicles or eruptions will be coming out under the old crust or over to the crust. Rawness, itching, tingling, crawling, and bleeding sensation. Eczema of the scalp and face. It is so tingling that the child cannot keep its finger off from that eruptions. Worse at night from the warmth of bed. So Ken is mentioning about the discharge, which is very offensive, carrion or a decomposed meat-like odor. Now we'll go to another drug, the Pyrogen, which is equally having all the discharges very filthy and very offensive in nature. Offensiveness runs through Psorinum. It in such a characteristic way that it is worthwhile mentioning here. Fetid odor, fetid breath, discharge, and every usings that will be smelling like of a carrion. Stool is so offensive that the odor permeate the whole house. In diarrhea, summer complaint, cholera infundum. The perspiration also become very fetid. Leucorrhea, which I told you while we were discussing in boric, which is very offensive. Eructations as if he had eaten hard-boiled egg and they had got spoiled, and they smell so to others. So when they have the eructations, they have the taste of a spoiled egg or rotten eggs. Nash is comparing this medicine with graphitis. If we examine, we will also find Psorinum resembling graphitis in many points. A close comparison will pay the earnest student of Materia Medica. Psorinum is very depressed in mind. There is great despondency, making his life and also those near to him very intolerable. The state of mind following acute diseases like typhus is specially benefited by this remedy. When writing of graphitis, we mention the resemblance of the two remedy in the stools, dark brown, watery, and intolerably offensive odor. Excuse me. This is found in bad cases of cholera infundum or chronic diarrhea. There is one valuable difference between them, between graphitis and Psorinum, and that is that the graphitis moisture is very sticky in nature, and that is not so marked with Psorinum. So that is because when we were discussing the skin feature, more than sulfur, we felt a similarity of the symptoms to that of the we felt much of the symptoms similar to that of graphitis. But in graphitis, the discharge which is coming out, it will be very gluey-like or sticky in nature, but that is not the feature with Psorinum. Again, Psorinum is very useful for weakness or debility during convalescence. The patient sweat profusely when taking the least exercise. Notwithstanding, as a rule, the skin is generally dry, inactive, and rarely sweats in graphitis. And in the stool symptom, he had made a comparison between Psorinum and cinchona or China. There is loss of fluid, blood, suppuration, etc. Would decide in favor of the latter, that is in favor of cinchona, where there is much loss of fluid, blood, or suppuration. And itching eruptions before or during the sickness to the Psorinum. One thing I forgot to mention in connection with the offensive stool, all excretions, diarrhea, leukorrhea, menses, perspiration have a carrion-like smell. Even the body has a filthy smell, notwithstanding frequent bathing in case of Psorinum. The Psorinum subject is very sensitive to cold air or change of weather, wants to wear a fur cap, overcoat, or shawl even in the hottest weather. Chronic complaints following or dating back for years to some imperfectly cured or suppressed acute diseases. So the drug relations, it is antidoted by coffee. I told you to remember this because while giving Psorinum, say the patient never to take coffee. Compatible with carboveg, cinchona, sulfur, especially when sulfur was indicated but failed to give any result, give Psorinum. Complementary to sulfur, basilinum is the acute of Psorinum. After lactic acid for vomiting of pregnancy, after arnica, sulfur can be given after Psorinum in mammary cancer. It is inimical to lachesis. And so many other comparisons are being given. Sick babies who fret day and night jalapa, but we told that that is coming from Alan Skeenot. Then the thunderstorm aggravation, so that of phosphorus also. This one we didn't mention about the headache preceded by dim vision. So in case of headache, we told that it is having a hammering sensation, but in case of Psorinum, there is a headache which is periodic in nature and also preceding to that headache. Before the headache starts, they will be having a dimness of vision, like the symptoms. So it is not a simple headache, but more like a migraine that is having this dimness of vision. So we have other two remedies, lactifloratum and calibicromicum. So there is headache, which is preceded by dim vision. Headache amelioration, headache with hunger amelioration while eating, anacardium and califos. Headache which is ameliorated by nosebleed. Psorinum is having the symptom and also millilotus. Plica polonica, I told you that the hair will be glued together. So other remedies are lycopodium, Baryta carb, sarsaparilla, basilinum. Offensive cheesy concretions from throat. We learned that when they are having the chest complaint, they can raise some cheese-like or pea-like mucus, and that will be having a carrion-like odor. Similar symptom is seen in calimure. Amelioration by sweat, which is caladium and natramure. So they are having actually amelioration by sweat and aggravation in case of mercurius. I should note it down. Amelioration, lying down and keeping arms stretched far apart, and the medicine will be asked. But asked is usually having a sitting up. Sitting up is actually the ameliorating feature whenever they have dyspnea. Eruptions easily separate, similar to HEPA or even petroleum. Now, Psorinum, that which has taken from the homeopathic remedy pictures. So here, the book actually says how that mental symptoms have been evolved. So, as an introduction, they are told that Psorinum people, they start to feel cold or that chilly nature when their food intake is insufficient. They get exhausted, the immune system is weakened, and then all the pathogenic agents, especially the mangue mite, maybe the scabies mite or the itch mite they might be indicating, can easily settle down in the organism. Psorinum patients present exactly these symptoms connected with all the deficiencies, and then they try to balance them by constant eating. So people who need Psorinum, they feel very poor, not only in a materialistic point of view, but also in terms of positive, enriching experiences in their life. They believe that they missed out a lot of things in their life, that they never received any benefits, but are always cursed with bad luck. Always we can see that people who are saying about my childhood was not blessed. I was deprived of so many things, even parents' love or education or whatever, and that the pessimistic feeling, not pessimistic, but the feeling that they were not blessed or they were forsaken, that will be towards the end of their life also. In every time we can say they would be complaining about their life a lot, that they didn't get much blessings or other things like people around them received. These constant sad and self-pitying thoughts make them weak and turn them into very veritable pessimists. Everything always goes wrong. They give up hope and get very depressed. Owing to their weakness, their resilience is lowered and they often become very ill. They're constantly freezing, catch cold very easily, and suffer from many persistent skin affections. It is remarkable that if one day they actually do feel well, fate will have caught up with them the next day and they fall ill again. A Psorinum person is pursued by bad luck. Recurrent illness make them desperate so that they feel like they are not going to get cured. No therapy will be helping them. They lose all confidence and they think that they will be never well again. They become very grumpy, constantly complaining, and thus involuntarily isolate themselves. In their ensuing loneliness, they develop a great restlessness together with fear of future, of illness, of further poverty. Deep hopelessness spread inside them, and nothing in their life seems to go right. The only thing that exists are suffering and negative experiences. As they think that things can only get worse anyway, they soon start contemplating like anything, anyway, whatever the life is going so bad, so just go and end the life. That is how they come into suicide, and it is as it is the only way out of this desolate life. However, the above description is extreme, and Psorinum is not just a remedy exclusively for losses, like what we saw in the earlier slide. It just makes us feel, in a nutshell, if we say, we feel like, oh, a complete loser. That is what we come about Psorinum. But then they go to that. It is not that it is a remedy exclusively for losses. It may also be indicated in earlier, more hopeful stage when the fears and negative attitude towards life or the onset of physical symptom pointing towards the remedy. Psorinum patients can typically be recognized by their rather unkempt appearance. Their hair is greasy, their clothes are torn or dirty, and in contrast to sulfur, who often simply is too lazy to wash, it seems like Psorinum patient cannot be washed clean. Acquired cleanliness and ostracism by society may, however, tone down these unclean hints which point towards this remedy. They may even be missing completely. Like sulfur, Psorinum is a sodic remedy, meaning the patient or one of his ancestors suffered from scabies or another skin affection. As a result of the suppression of the skin affection, people often suffer from generations from physical or mental symptoms, and that is often connected with the keyword lack, which means there is a lack of body heat, lack of resilience, a lack of love of life, lack of self confidence, or a lack of hygiene. So, put in short, they are in a poverty or a poor stage where there is no money, no love, no job, no food. Fear is highly characteristic. Already they are in poverty. They will be having, if the condition goes on, they are going to get more in poor stage or poverty stage. They're very much feared of health because of all the ongoing diseases and fear about the future. They're very hopeless, pessimistic, and morose people. There is a triad of depression, suicidal tendency, and also offensive order. Feel inexplicably well the day before he gets ill. Complaints of the respiratory tract or asthma, which is ameliorated by lying on the back as if hanging on the cross. Skin affections, strong itching, must scratch until it bleeds. Despair from itching skin, believes he will or she will never be well again. So that is with Psorinum. The last remedy for today is Pyrogen. After Pyrogen, we will stop. Whenever it is finishing, we'll stop after Pyrogen. I'm not taking radium bromide. So Pyrogen, what you know about Pyrogen?
Septic fever.
Yes. And someone else, Pyrogen.
I usually had fast heart rate.
What habit?
The heartbeat is going fast.
Yes, yes. Heartbeat. Heartbeat is very fast. Yes, it's a septic fever with heartbeats going very fast. Yes. Then
Delirium.
delirium. Yes. And one more key feature. When I was saying Psorinum, I told you that symptom actually. Nature of discharge. Oh, I told you the clue. The discharge, how it will be.
Offensive.
Yeah, very, very, very offensive. Not just offensive, it's just very offensive. Even they say a sentence like, what is that? The carry on like, or like what we used in Sorinum itself. Carry on like means, um, after that, the postmortem, that much offensive, smell. That is the pyrogen. So whatever features now you're told that make pyrogen in total. So it is the artificial sepsin, a product of the decomposed chopped lean beef in water, allowed to stand in the sun for 2 or 3 weeks, and then dilutions are made. So pyrogen for the septic condition, where pulse is disproportionate to the temperature. Mentally, the person is greatly restless. They are tossing about in bed. They're very loquacious, rapid thoughts, thinks and talk faster than ever before and during fever. Delusions as if crowded with arms and legs, that the body covered the whole bed, that someone is in bed with him, like bacteria. Yeah. That cell seems too large. Pyrogen is a remedy for septic conditions, peritonitis, septicemia, last stage of tuberculosis, fever which is puerperal, septic, hectic, zymotic, typhoid, intermittent, you name it, but we should have all those symptoms. Not like an acute fever, but the zymotic fever, like the septic fever, the like where the frotalis horridus is being indicated, such type of fevers. The pulse rate is accelerated, disproportionate to the temperature or the reverse. High fever with not so high heart or low fever with high heart rate. The sore, bruised, aching pain, like what we learn in case of arnica, bacteria, petroleum. Bed feels too hot, aching through the whole body, extremities and bones especially, that aching pain during the chill stage. Amelioration, motion, warmth, and walking must move to relieve the soreness of that part. Chilliness, this chilliness that is being affecting the bones also, that is also very important. The chilliness, chill sensation of pyrogen. Chilliness of bones and extremities, as like the symptom we can see in case of asafoetida also. Chill beginning between the scapula and followed by coldness of the bones. Tongue, that's also another important symptom of pyrogen, like a beefy tongue. That's how it say, like it is red, smooth and glistening, like beefy tongue or like that of a cow or beef. The red stripe in center of the tongue. Lochia will be very thin, acrid, offensive, suppressed, especially from cold. Because this is a very good remedy, especially when there is a threatened abortion, and even like the symptom sabina or ossicale is also indicated. Uh, if something that is remaining, the after to delivery, the placenta or anything that is being remaining inside the womb, and that resulting in septicemic conditions. So the lochia that will be coming out, it will be very offensive in that manner. So pyrogen is indicated in that septic condition also. So that is why the lochia will be very offensive, acrid, suppressed, especially from cold. There will be a sweetish, putrid taste in the mouth. Uh, the stool also will be very offensive, like black balls, in case of like in Chelidonium opium, what we say. Very aware of the heart, which is throbbing in nature. Aggravation from cold, bad meat, amelioration from motion, and also walking. Boric, this remedy was introduced by English homeopaths, prepared from decomposed lean beef and allowed to stand in the sun for 2 weeks and then potentized. The provings and most of the clinical experience has been obtained from this preparation, but subsequently Dr. Swan potentized some septic pus, which has also been proved and clinically applied. There does not seem to be any marked difference in their effects. So most of the English homeopaths, when they were proving the drug, they actually took the beef that was getting decomposed, and then that was used for the, for the proving. And then Dr. Swan, who is actually pyrogen, is also actually a nosot. So Dr. Swan, who was much into this proving of the nosots, he took actually the pus, not the lean beef or the decomposed beef, but the septic pus, the pus coming out from a patient who's having septicemic disease. And then he proved it and also given for clinical conditions. But they say that the symptoms were not much different. Both the sources, it indicated the same symptoms. Pyrogen is a great remedy for septic states with intense restlessness. And that is very important, the septic state with intense restlessness, so that they will be always tossing about in their bed. In septic fevers, especially puerperal. Puerperal is what after to the delivery or even the abortion, it happened. And then something of the uterine appendages or anything that is being remaining inside the uterus, which results in the puerperal infection with a very offensive lochia. That's where pyrogen is more indicated. So in septic fevers, especially the puerperal fever, Pyrogen has demonstrated its great value as a homeopathic dynamic antiseptic. For the hectic fever, typhoid, typhus, ptomaine poisoning. Ptomaine poisoning is what is that? Postmortem wounding, etc., or even what is the exact word meaning of ptomaine? Do you remember what is the exact word meaning? It's something related to postmortem, and then we getting that wound, and then that getting infectious, like that of an ulcer. That is ptomaine poisoning. Diphtheria, dissecting wounds, sewer gas poisoning, chronic malaria, after effects of miscarriage. All these conditions at times may present symptoms calling for this unique medicine. All discharges are horribly offensive, be it menses, lochia, diarrhea, vomit, sweat, breath, etc. Chronic complaints that date back to the septic conditions, threatening heart failure, enzymatic and septic fever, influenza, and typhoid symptoms. Person, Pyrogen, in mind, full of anxiety, loquacious, thinks he is very wealthy, restless, feels as if crowded with arms and legs, cannot tell whether dreaming while awake or asleep. So, from Clark, the proving information. John Tristram was the first in 1880 to suggest the use of this substance as a medicament. Burden Sanderson has stated that only liquids which contain bacteria or have a marked proneness to their production are capable of setting up a pyrexia. This remark struck Drysdale, and though of course he could not endorse the only of the statement, many drugs known to homeopaths set up fever. He saw that the fact might be turned to account. So he tend to prove pyrogen, and the following effects were observed. From a non-fatal dose, he did the two, the fatal dose and the non-fatal dose. In the non-fatal dose, the animal shivers and begins to move about restlessly. The temperature rises from 2 to 3 degrees Celsius, the maximum being reached in 3 hours, thirst and vomit coming on, followed by dirty and thin mucus discharge, and finally bloody diarrhea and tenesmus. In 5 hours, these symptoms begin to subside and the animal recovers with wonderful rapidity. When death occurs, it is from heart failure. In non-fatal cases with gastroenteric symptoms, the temperature gradually rises for 4 hours and as gradually subsides. In fatal cases, it rises very rapidly to 40 degrees Celsius, then rapidly declines to below normal. In a fatal dose, this was the symptoms that he got in a non-fatal dose when the temperature rise was also comparatively in a slow manner with much shivering and restlessness, thirst and vomit. The discharge is offensive, bloody diarrhea with tenesmus. And in 5 hours, all the symptoms begin to subside and the animal recovered because it was a non-fatal dose that was given. And in case whether that happened also, it was due to the heart failure. But when the fatal dose was given, which is going to cause some fatality, there was intestinal hemorrhage, purging, collapse, and death. After death, extravasations of blood were found in heart, pleura, and pericardium. So after that, when they did the postmortem of that concerned animal, they found that there was bleeding from the heart, pleura, and pericardium. The spleen is enlarged and also full of blood. Mucous membrane of stomach and small intestine is intensely injected with detachment of epithelium and exudation of a bloody fluid which distends the gut. The blood is dark, the corpuscles being in clumps, and many being dissolved in the liquor sanguinis. White corpuscles partially disintegrated. So these were the two set of symptoms that he noticed in animals when the fatal dose was given and also the non-fatal dose. And in fatal dose when given, you could see the symptoms even leading to death, the hemorrhage being very characteristic, hemorrhage from all the different organs, heart, pleura, pericardium, intestine, stomach, everywhere. Even the red blood corpuscles disintegrated, white WBC being disintegrated. Israel prepared a tincture of pyrogen, which he preferred to call pyroxene, maybe because the temperature was increasing. Since it is not a mere fever producer, otherwise have called it sepsis. But this is too close to septicemia, a name given to a related and perhaps identical nosode. But I have chosen to retain the name pyrogen, by which the remedy is best known in homeopathy, and put his own suggestion into practice. His success was very encouraging, but as he continued to use the tincture and lowest attenuation, the difficulty of keeping the preparation was not small, and the remedy did not come into extensive use until Burnet published his pamphlet on pyrogenium in fevers and blood poisoning in 1888. Burnet used chiefly the 6C, which is perfectly harmless and which will keep indefinitely. Heath, who made one of the preparations used by Burnet, gave some of it to Swan of New York, who ran it up to the high infinitesimals. So in this PPT or in this slide, they're saying about how Drysdale was using pyrogen. He was actually prepared a tincture and he actually wanted to call it as pyroxene. However, Clark felt that the more name to be retained in his textbook should be pyrogen. So he kept the name as pyrogen itself in his textbook. But in case of Drysdale, though the symptoms were much uh, uh, yielding to pyrogen when it was indicated, there was much success. Drysdale was using mostly the tinctures and the lowest attenuations. So to make the preparation, to store it, everything was in a difficulty. And much of the people were not using pyrogen. They started using after Burnet published about it in 1888. And while in case of Burnet, he used the 6C potency. So people started using the 6C. And then from Burnet, some of it was sent to Swan, the person who was when we said about the Psorinum. I told you the Swan was mostly concentrated in this proving of nosodes. So then when it got into the hand of Swan, the 6C, it started to go into infinite or high potencies. So from Kent, the potencies prepared from heath decomposed beef have been used by the author for many years against all form of septic fever and sequel when the symptoms agree. Violent chill intermingled with heat and sweat or dry heat with marked aching in the limbs. Restlessness amelioration by motion and heat. The sore bruise condition, we need to compare it with arnica and baptisia. The aching in the bones, like that of the eupatorium, amelioration by motion and heat, like Rustock's. Pain, all aggravated by sitting. Complaints come on from becoming cold and from cold, damp weather. These features are found in hectic fevers in the last stage of phthisis as well as septic fevers. It aborts puerperal fever in a few hours when clearly indicated. In cases of typhoid, when there is confusion like that found in baptisia, and the heat is too intense for baptisia, pyrogen should be considered. When the temperature reaches 41 degrees Celsius, this can be considered pyrogen, and there is great soreness and aching. This remedy will make great changes in a single day. But if the pains are ameliorated by motion and heat, it will abort the fever. The pulse is extremely high and the temperature not correspondingly high, this remedy will be useful. On the other hand, when the pulse and temperature are out of rhythm, this remedy should be considered if the case is of septic origin. Great pain when the flow from an open abscess becomes scanty. Violent burning in an abscess, like that of arsenicum, anthracinum, and tarantula. Offensiveness is a characteristic feature, putrid cadaveric odors, fevers from sewer gas poisoning, erysipelas. It cures many chronic complaints that date back to septic conditions. She has not been well since a puerperal fever many years ago. It's a good reason for thinking of pyrogen. Ken says about a case, a young man of good inheritance. He suffered from blood poisoning and made a poor recovery, and for several years he was affected with abscess in various parts. He was pale and sickly. Rheumatic complaints and stiffness was also there. At this time, there was an abscess of the calf slowly forming. He took pyrogen and made a rapid and complete recovery. This time, the abscess that was forming in the calf muscle, it did not open. He has remained in good health now, even after 10 years. This medicine has cured Bright disease that could be traced to septic origin. It is most useful remedy when there is threatening heart failure in septic enzymatic fevers. Septic hemorrhagia, when the blood is dark, it will often save life in the most dangerous and rapid septic fevers. Mind, the person will be very loquacious, there will be delirium and confusion. Knew her head was on the pillow but did not know where the rest of the body was. Or in other words, you feel or the patient feels like the body is scattered all around the bed. Feels when lying on one side, she is one person, and another person when turning on other side. The exact delirium. Sensation as though crowded with arms and legs, or the patient is having many arms and many legs. So much similar to like baptisia, but in case how to differentiate will be even baptisia, it is also having very offensive discharges, almost the similar symptoms. But one difference is the temperature will not be going as high as like in as high in baptisia when compared to that of the pyrogen. So if the temperature is running very high, baptisia will not meet the condition, but it will be pyrogen more so indicated. Comparison to streptococcinum, antifebrile action, septic infections, rapidity in action, and staphylococcinum, especially in acne, abscess, furuncle, empyema, etc. Laxasis and typhoid fever with soreness, bed feels hard, complementary to bryonia. But complementary to complete action, but bryonia doesn't have this much offensive nature. This one we have already discussed. Okay, it was radium bromatum, but I don't want to do radium bromatum today. Can we stop here? Do you want me to complete radium brom also?
Should be okay.
Okay.
Yeah.
So radium bromatum. Oh, by the way, before going to radium bromatum, have anyone of you given pyrogen?
No.
Even I, because of that special condition, the septic fever, the puerperal fever, we should have that condition. That patient should be there with us to even try. So I have never tried pyrogen. I don't know. Even in our college also, I have never seen someone giving pyrogen. No, no, I don't remember giving pyrogen. But not the septic fever, but I remember pyrogen for some offensive Offensive abscess. Yeah, some patient who was having very offensive abscess. Whenever he used to go to the dressing room, every day his abscess had to be cleaned, and the dressing room was near to our OP. So in our hospital, all the six OPs were there, and all the OPs are together on room like that consecutively, six rooms. And towards the end, it's the dressing room. So whenever this was a IP patient actually, so whenever he goes for this abscess cleaning, it would be so offensive. Even though every day that was being cleaned, while cleaning calendula, not calendula, even echinacea was also used because of its high pustular in nature. And echinacea is also always told as good for blood poisoning, like a septic condition. So echinacea tincture was used for this cleaning purpose. Still, the very next day, when it is ready to be cleaned and cleaned again, it will be very offensive. That person, I remember, Pyrogen was given, yeah, but not in a puerperal fever, never. So radium bromatum, another medicine mostly given for skin complaints. This also I have not tried. Had anyone given? Anyone who is having experience with radium bromatum? Or do you remember because Sir has taken this medicine for you people? So you remember this medicine? Any experience, Sir, being told?
No, never tried before.
Any case that you remember that Sir Partha Sir has discussed with you people? Because I remember this drug only theoretically, okay. Not sure.
No, no, there's no real life cases has been discussed so far, only theory.
Yeah, because I don't know. Maybe this was mostly indicated the people who are working like the occupational diseases and radium brom being resulting in skin affections from that. They proved the medicine. But never I had chance to give this medicine in any patient. Never and not never in clinic I have seen in my hospital experience. No, never I have seen radium bromide being given, and even I doubt whether in our hospital, I never had in my own clinic, okay? I never had radium brom in my clinic. And I don't think in our hospital, even this medicine was available. So the discovery of radium and its properties in 1898 by Pierre Curie and his wife, Madame Curie, why his name was not given, set many persons thinking, and among them, naturally, those who are engaged in the healing of the sick. Curie himself made the first proving. He put a tiny bit of radium salt in an India rubber capsule and fastened it to his arm, leaving it there for 10 hours. When he took it off, the skin was red. The place turned into a wound which took 4 months to heal, leaving a white scar the size of a shilling surrounded by discolored puckered skin. On another occasion, he left it only for half an hour. A wound appeared at the end of fortnight and took another fortnight to heal. On third occasion, oh my God, he was going on experimenting. Left for 8 minutes only. 2 months later, the skin became red and a bit sore, but it soon passed off. So he was the first brewer. So, according to Clark, it is the eyes, the skin, joints, and alimentary tract being particularly affected. Diefenbach quotes Professor William His of Berlin, who published an article on the use of radium in gout and rheumatism. He used radium emanations, radium injections into joints and muscles, and also described drinking of radium water. The proving showed the homeopathicity of the drug to this condition, although he used it empirically. Diefenbach, who had been investigating radium for 10 years before he published his pamphlet, records that as a result of former X-ray and radium ray experiments, one prover's hand had, when the proving commenced, eczematous eruptions, cracks, scaly excrescence, and wart-like outcroppings. After his provings with 6X, these gradually disappeared. So good for him. All the skin complaints, the eczema, the cracks, the scaly excrescence, and what, everything got cured with 6X. This is confirmed by a case reported to me by Mr. E.S. Pierrepont. Yeah, should buy some radium brom and check for warts, because sometimes warts it doesn't get clear with the common remedies. So maybe radium brom, but I don't know whether it is available or not. A girl was employed in the X-ray department of the hospital with which he is connected, developed dermatitis on the right hand and fingers. An ointment was prescribed without any benefit, and cracks appeared on the skin. 2 doses of radium bromide 30 were given, and on Mr. Pierrepont's suggestion, one in the morning and one in the evening. The following day, the patient came out in a rash, which the matron mistook for measles, eyes watering, fingers very sore, and she felt very ill. By the following day, the rash had disappeared and she felt well. The fingers were now better and they got quite well, except a sore feeling that was left after washing. So the girl who was employed in X-ray department who developed dermatitis. Maybe we should keep it as a specific, like people who work in X-ray department, they're definitely going to have some skin complaints. The thing is, they don't come to us because when the people are working like in X-ray, all this radiation exposed, they will be having this, if that company or the area where they are working, and mostly if there is X-ray department or all this radiation, they will be having that particular section where there will be the occupational disease management something. So they will be dealt as such. But in case if we get a patient with a X-ray exposure and then the skin complaint, as a specific, we should keep radium bromide to know what is happening. According to Boric, it is an important addition to Materia Medica, especially since the provings by Diefenbach have I can't say that word. Have precisionized its use. My God, radium bromide of 18 lakh radioactivity was employed, found effective in the treatment of rheumatism and gout, in skin affections, especially acne rosacea, neve, moles, ulcers, and cancer. Lowered BP, severe aching pain all over with restlessness, better moving about. Chronic rheumatic arthritis, lateness in appearance of symptoms. Ulcers due to radium burns took a long time to heal. Marked increase in the polymorphonuclear neutrophils. So it can increase the immunity of the body. There is great weakness. Ailments from X-ray burns. And in mind, the person is very apprehensive, depressed, fear of being alone in the dark, great desire to be with people, and tired, irritable. Headache, vertigo with pain in back of the head, left when in bed, occipital and vertex pain, head feels heavy. I don't think this symptom is very important. Leave this. It's the skin and actually the gout and rheumatism that is important. So we'll skip through these symptoms. GIT. Oh, there is pain, violent cramp, full of gas, pain over McBurn is buoyant. Pain over McBurn is buoyant, which indicates appendicitis, and at location of sigmoid flexure. There can be much flatulence, alternating constipation and loose movements. But still, I wouldn't go for this. Musculoskeletal system, that is important. Pain in the back region, especially the back of neck. Pain and lameness in cervical vertebra. Worse aggravation or drooping head forward. Better standing or sitting erect. Lumbar and sacral backache. Pain appears to be in the bone. Continued motion relieves. Backache between shoulders and lumbar sacral region. Better after walking. Extremities, there will be severe pain in all the limbs, joints, especially in knees and ankles. Sharp pain in shoulder, arms, hands, and fingers. All the joints, the bones, the limbs, everywhere that is being affected. Leg, arm, neck feel hard and brittle, as though they would break on moving. Arms feel heavy, with cracking in shoulder. Pain in toes, calves, hip joint, popliteal spaces. Arthritis, aching pain, which is worse at night. Dermatitis of the fingers. Trophic changes in the fingernail. Dystrophic nails, where the fingernails or the toenails are deformed, thickened, or discolored. In the skin, there are small pimples, erythema, redness due to inflammation, and dermatitis with itching, burning, swelling, and redness. There is necrosis and ulceration, itching all over the body as of a fire, and epithelioma, where there is abnormal growth of the epithelium or any cancerous condition. Aggravation from warmth of bed at night, waking up, shaving, washing, smoking. So many time aggravation. And amelioration from motion, open air, hot bath. Drug relations comparison with anacardium. The ulceration produced by anacardium is much similar to that of radium. It may appear elsewhere than on place of contact, and it appears late. Antidote to Rus veninata, tellurium, and belladonna. Antidoted by Rustox and Nux moscata. Rus veninata, that is also a medicine given for dermatitis or skin eruptions, erysipelas. And tellurium is a specific for, it is also for skin complaints, but it is a specific for ringworm. And belladonna may be because of its redishness, erythematous condition. And this medicine can be antidoted by Rustox and Nux moscata whenever it is going to cause a aggravation. Thus, veninata acted promptly in many cases of clog. Tellurium is associated with radium in origin, and its symptoms are closely similar in many respects. Radium bromide has warm sensation down esophagus, and manzanilla has the same sensation rising up esophagus. Carbo animalis has an aggravation from shaving, and here also they are having an aggravation from shaving, right? Yeah. Radium bromide aggravation from shaving. Oh, aggravation from shaving, maybe the eruptions. So that is the end. So in case of radium bromide, please remember about its skin and also musculoskeletal symptoms.